So coming to QIP. QIP is called a quality improvement project. You need one throughout your training. Now, what is a quality improvement project? Anything that's made a change in your practice. So, as against a quality improvement activity where you saw something and you just, it might be like in my case, the respiratory referrals, you just change it there and moved on. A quality improvement project is like a cycle. So you saw something, you did a project on it, and then you came back later to see whether something has changed. I don't know if I can. Okay, let me give an example. Now let's look at the second line here. It is said here, during your primary care post, you are required to complete a quality improvement project with the aim of improving patient care. So, as with audits, it looks at the quality of care provided with the aim of improving it, and both require measurements to demonstrate change. So, you need, when you have seen the problem and you have instituted a change, you now have to have a method of demonstrating that change. Now, you will see a lot more guidance on the RCGP website. Let me give an example of my own quality improvement project. First of all, if you're going into a rotation, most people do this in their second year, some do it in the second half of their first year, but always know that it must be done in a GP practice. For your quality improvement activity, you can do it hospital, but for your QIP, you must do it in your GP practice. And what I would strongly advise is that you do it in your second year. Why? Because in your third year, you have a lot of things to do. You have your exams, you have your leadership, you have your prescribing, you have different types of multi-source feedback, which is what we'll talk about later. So it would be good to sort it out and move on. So most times people ask, I've seen people ask, I want to do a QIP, what should I do? What I would usually advise is go to your practice, ask your supervisor. Most times the practice has some things they want they want help with. So ask them, I want to do a QIP. They always have lots of topics they already have. So in my case, it had to do with people that have CKD. My supervisor had told me that they've noticed that most people that have CKD are not even coded on the system. So if they're not coded on the system, they're not being followed up. So they're not having their annual follow-ups, they're not having their annual ACRs done. So the first thing for me to do was to get them coded. So I had to find out everyone that had CKD, and I'm sure we all know the definition of CKD. So I asked the secretaries to give me the data of everyone that has CKD. And then after that, I had to check for those that were not coded, and quite a number were not coded. So I had to code them. And that coding generated immediately the number of people that needed investigations to be done. So I did that. And then, so as I was saying, so I had to get the people that have chronic kidney disease. I had to check whether amongst all of them, has any of them been placed on Ramipril? Has any of them been placed on Ramipril? Have we had their ACRs checked? So all this gave me a lot of information. And then they were coded with reminders to come for these investigations annually. Now, in my case, because because most of them had not had these investigations even done at all, that coding triggered a massive reminder for lots of people to come have their ACRs done. So that was already a change. Okay. And then in about 3 to 4 months, other changes started happening. Now, for my QIP, it wasn't just that. I now had to put it into a PowerPoint presentation. So talking about chronic kidney disease, why it's important to monitor the data from the practice and things like that. And then the change I have made and what I expect to see later on. So when you do a QIP, you go to, when you finish and you've done everything, you click on new QIP and then you talk about your title. Okay. You put your date, you explain why you chose this project. What did you notice? Did you see a patient that has CKD and hasn't been put on an ACEI? Did you see a patient that had CKD and hasn't even had the ACR done? So why did you choose it? So what was the aim? And then your baseline data, what information did you gather? So you can see that this is much bigger than a QIA. And then what data did you collect? How did you test out your changes? So in my case, we started checking those that had investigations done. Were there people that were not on Ramipril that we now had to put on Ramipril because of their ACR level? Then who did you discuss with? Who have you engaged with? Then what changes? And if you did not see any improvement, which is also fine. I've had colleagues that did not see any improvement. You just explain why. Did you leave that rotation? What did you learn about this? Do you intend to go back to find out? In some practices, they would say it's okay. And then when another GP trainee comes, the person will continue. So it's something you need to find out. And then what did you learn? And then in the attached files, this is one of the areas where I attached a file. I would attach my QIP presentation. That's whole PowerPoint, because the PowerPoint will come from introduction of CKD, data found, discussions, stakeholders discussed with, everything. So here I would attach the whole QIP presentation, save and send to my supervisor. Now, QIP is one of the most important things. Everything is important in the portfolio, but it's one of the things I hear that the panel always looks out for when you're completing training. So something that is very, very important. It needs to be original. It needs to come from you. It needs to be something that most times should benefit the practice you're working in. And when you look at your course, you will see a demo on the types of on how a QIP entry should be done. And if you are stuck on what to do for QIP, always go to RCGP website. You will see different topics. But I would advise that you should ask your practice. Most times there's something that they need. Many practices these days would want you to present your QIP at their clinical meetings or things like that. And it's also a way to sell your presentation skills, your organization skills, because you never can know where your name will be mentioned, if that makes sense.